Roots of the Science podcast with your girl, Anne with an E.
Hello, everyone, and welcome to another episode of the Root of the Science podcast with your girl, Anne with an E. My guest today is Dr. Chinwe Iwu-Jaja, originally from Nigeria and based in South Africa. In this episode, we learned that away from the science, he's a convener for Girls International FrankTalk that discusses various topics that concern women in the 21st century. With regards to how her interest in public health formed, she attributes this to when she was younger and she visited local clinics. Dr. Chinwe says that she saw the public health posters and she was eager to be involved in this field. Currently, she is a postdoc at Stellenbosch University involved in different projects. Due to the prevalence of the pandemic, it has forced researchers to deviate their research and focus on the virus. We discuss one of the projects where she wrote several comments on the COVID-19 pandemic, in particular, the impact of burial ceremonies on the spread of COVID-19. Further, we discuss about her blog called Health Facts with Chinwe, where she shares health information to the public. Lastly, we unpack the importance of public health experts in the dissemination of accurate information and the backfire that they sometimes face educating people who do not agree with their expert views. Tune in to learn more about all of this. Let's go. Hi, Chinwe. Welcome to the show.
Thank you very much, Anne. Thank you for bringing me on board today.
It's an absolute pleasure. Thank you for taking the time to chat with me, and so that all of our listeners can get to know more about you and everything that you do. So for the purpose of us just diving right in, can you please briefly introduce yourself for us? So where are you from, where you currently based, and what are you currently doing?
Okay, my name is Chinwe Iwu-Jaja. I'm from Nigeria, and I'm currently a postdoctoral research fellow with Faculty of Medicine and Health Sciences, Stellenbosch University here in South Africa, Cape Town to be precise. And so that's it.
Okay, perfect. Thank you so much for that introduction. So now, before we get into everything that you do, I always like to have this moment where we chat with the people and get to know them away from the science. So I know from away from the science, you are a convener for a women's group called Girls International FrankTalk. Hope I said that correctly.
Yes.
Okay,
yes.
Perfect. So can you please just quickly tell us about what this is about and what you do, etc.?
Okay, yes. So I'm a convener it's an online group for women who are based in all parts of Africa and then even outside Africa. And so we basically meet once in a while, once or twice in a month, where we discuss various topics that concern women, especially in the 21st century. I decided to create this group during one of the lowest points in my life. I had a lot of challenges at that time. I had challenges balancing my life, having, moving on with my career and, family relationships and all of that. So I really needed help. And then I thought I really wanted a group where I could get this help from, because I knew that obviously I wouldn't be the only one having this kind of challenge. But then it was difficult for me to find such a group where, women would meet and talk about their challenges and how they solve these issues. And so I decided to create one myself. I decided to create this group and then invited family, invited friends. And so that's how we started. But now we have grown. We are over 200 women now. Wow. And we discuss a lot of topics. Yes, topics ranging from career, business, entrepreneurship, health, and so on. So it's been amazing.
It sounds amazing. It sounds amazing. So let's say somebody now is listening and is like, this is something that I need. Because I think as women, we go through our own fair share of struggles, like how you mentioned, especially in the 21st century. So how can somebody join that group if they are interested?
Okay, I think I need to send you the WhatsApp link that they can join in. So I would send you the WhatsApp link when we're done with this talk, so they can always join in.
Okay, perfect. So what I'll do is I will also add it to the description box and the links when we share this episode so that people can join in. But that's such a lovely initiative, and I think you're doing some very important work. And yeah, it's important. It's important. So now let's just backtrack a little bit and just talk about the reason why we have you here. I just want to find out, you are a public health specialist, right? But before all of that happened and before you were Dr. Chinwe, how did you even get involved in this field of science? Was it something that you always wanted to do? Or was it, with most cases, some guests just say, it just happened to me, Anne. So what is your story? What is the root of your science?
I would also say it just happened to me, but I would also start by saying that I didn't really even have any influence. I mean, in terms of a mentor or like someone I looked up to. Growing up, my parents are business people, both of them. So I grew up buying and selling. I grew up being taught how to buy, sell, and make profit. Although on the side, my parents were the people that made sure that all their children would go to school. So that was basically the kind of influence I had. My dad insisted that we will all go to school, and that was his major vision. And so, in fact, growing up, we were not even allowed to study or do our assignments in the shop, to tell you how strict my dad was with his business. And so, but he only would wake us up very early in the morning. If we had tests, if we had exams, he would wake us up to study, or maybe weekends. Those were the times we had to study, or we would have to do our assignments in school before returning home. So they didn't even get the opportunity to go to the university. So I didn't have those kind of advice that parents would give their kids on, the career path to choose and all of that. So it was basically the support I had from them, the moral support and the financial support. And my dad, like I said, I would always mention him. He was my number one cheerleader, even though unfortunately I lost him when I was about to complete my PhD. We had great plans. He said he was going to attend my graduation and all of that, but unfortunately he couldn't make it. But then I always wanted to do science because I did so well in science subjects from my primary school days to even high school. I loved physics, chemistry, and all of those science subjects because I thought they were just straight to the point. I really wasn't someone who liked to write a lot. So with this subject, they were just straight to the point, all or none. So what is this? You just go straight to the point and you solve it and you're done. Unlike my mates then who would write lots of pages. So I really was lazy, when it comes to writing. So I preferred the sciences, and that was how I got into it. And I was also doing well in those subjects. And then, so with regards to the medical profession, because I have a background in pharmacy, so this stemmed from my visits to the clinics. When I used to visit the clinics with my parents, for maybe our routine deworming and all of those. So, if you go to clinics, you will see those photos that are usually placed on the walls where you would see children who are either suffering from malnutrition or children who have measles and all of those. Those are all the public health information, maybe trying to encourage mothers to vaccinate their kids or trying to encourage mothers to feed their children with proper diets, balanced diets, or even those photos where you see women being encouraged to go in for family planning. So for me, I thought to myself, I think I like this and I would love to be part of creating solutions to these problems. I didn't even know that was me loving public health.
Yeah.
But that was actually where it started from. So from my high school days, I made up my mind I was going to study medicine. That's usually our first choice. But unfortunately, I couldn't get medicine. So pharmacy was my second choice, and that was how I got into pharmacy. But then because I loved public health, I still pursued it. And here am I today with a PhD in public health there.
That's a beautiful story. Thank you for that. It's quite interesting that even without you knowing that it was a profession, but it was kind of like priming then when you're going to visit these places that this is something that you want to do. So then I would just like you to just quickly take us through, how did you end up coming to Stellenbosch? Where did you only come for your PhD, or were you here previously with your other qualifications?
I came for my PhD in Stellenbosch, but I started from Nigeria. I did my undergrad in Nigeria, and then when I finished my undergrad, I was also interested in pursuing my master's. So it's quite an interesting story anyways, but
please
I had registered. So I had registered for my master's in Nigeria, and then I now met this guy who eventually became my husband. So, but he also, at that point when I met him, I didn't know he had applied to a university in South Africa. So we just started dating at that time. And so after some months, he now told me he got admission to pursue his own master's in South Africa, and then he decided to leave me behind and go for his master's. But then after a year, he was like, no, I think you need to. So then we were already planning to get married.
Oh, okay.
Then, so he thought that I think it was going to be better for me to join him rather than staying in Nigeria. And I had even done a year in Nigeria, but it was quite a tough decision for me because I was in between. I told him, no, I'm about to even complete this. Shouldn't I go? But then I sought for advice from elders, and then they were like, no, you have to join him. So that's actually how I found myself in South Africa. So but my master's, I did my master's in University of Fort Hare in the Eastern Cape province.
Yes.
But like I said, I've always been interested in public health. And so after my master's, it was another tough decision for me to make, because I like choosing between having to stay with family or having to go for that which you want to do for yourself. So I had to, but we had that discussion, and then since it's PhD is a bit flexible. You don't really have to be there every time. So I decided to. I applied in several universities anyway. I applied in several universities, but Stellenbosch was the only one that was successful. So, and that was how I found myself in Stellenbosch.
Oh, wow. What a story. So it's kind of like a bit of a love story and a bit of an academic story. I love it. I love it. It's very, like you said, it's an interesting story. So I see how you're so persistent to be like, no, come, I need you here. I need you here with me. That's amazing. So you came to Stellenbosch to do your PhD in public health, which you've got, and then now you graduated in 2019. Am I correct?
Yes.
Okay.
Yes.
Oh, so congratulations, Dr. Chinwe.
Thanks.
That is phenomenal. Thanks. I get so excited when I speak to
women doctorates. Like, it's so inspiring for me. So, and you're doing it with a family. That's even more commendable. I am like by myself, and I think I'm struggling. So just that you're able to do this and be a mom and a wife, everything else, and a family rather. That's fantastic. So speaking of your postdoc, currently you are at the University of Stellenbosch, and you're involved in several projects. Which is the case in any as a postdoctoral fellow. You don't really only work in only one thing like a PhD. So I know you're working on 3 major ones. So now I don't know if this might be a little bit of a hard question for you to answer on them. But okay, well, let me rather say the ones that you're working on, and then we'll focus on one for you to speak on. Is that fine?
Okay.
Yeah. So one of your projects, you're working on the availability of vaccines in Africa. This was your PhD project. Then another one that you're working on was the antimicrobial resistance in Africa. And then currently you are, I think it's only right for us to speak about this one because you've worked with some colleagues and you've written a couple of commentaries on the COVID-19 pandemic. So because we are about the pandemic, can you please tell us specifically about this project that you're working on?
The pandemic itself has somehow made researchers to deviate a bit in their research. If you notice, almost everyone is writing
definitely
something on COVID, and it's expected anyways. It's expected. So I have been involved in a couple of commentaries with colleagues. We've worked on the impact of antimicrobial resistance or the impact of COVID-19 on antimicrobial resistance. I've worked on the personal protective equipment amongst healthcare workers, more like looking at the availability of the PPEs and how the healthcare workers manage the supplies, and then convalescent plasma for the treatment of COVID-19. And then another one was on the impact of religion and burial ceremonies on the spread of COVID-19. Yeah, these are some of the projects I've worked on.
I'd like to touch on one, which is the one about the impact of burial ceremonies, which apparently, correct me if I'm wrong here, but I heard that during the time that South Africa was having that huge spike increase in the COVID-19 numbers, apparently it was due to certain places in the country where, because of cultural beliefs, because when you bury somebody, there's specific cultural beliefs that rituals that you need to go through, right? But then with COVID, there's a specific way of handling the body. So due to this other in certain places in the country, they were going against these regulations that are meant to happen, and it's quite interesting. So rather, let me let you talk about it, because I think it's better coming from the horse's mouth. So how was that study? What were some of the things that you found quite interesting in that work?
Okay, yeah. So I think you've even told half of the story, or even more than half of the story in that paper. But basically, yes, you're right. It was during the level 5 of the lockdown, when the country was on complete lockdown, and the cases were increasing exponentially. So we heard that there's a certain surge in the number of positive cases, especially in the Eastern Cape province. We are traced to some burial ceremonies that took place. And so, we as Africans, we are quite cultural people, and we have this communal way of doing things. So you would always expect a large crowd to attend events, and this has always been part of us. So but with COVID and with the new measures and all of that, I think it was probably difficult for people to adhere to these safety measures. For example, social distancing, especially. People, as at that time, the events were actually supposed to be for 50 persons at most. But we know that many of these events actually had much more than that number. And aside from that, social distancing was also a very, very huge problem. People did not adhere to social distancing. And obviously in events like that, people would hardly adhere to social distancing.
Yeah,
it's an opportunity for people to catch up. It's an opportunity for people to exchange pleasantries. People would talk to each other, even if they were supposed to wear masks. Some may wear, others may not. And even if they do, they may not even wear their masks correctly. There's a lot of singing happening. There's a lot of, with all of those things that come with burial ceremonies. So we thought that was actually what would have led to this spike in number of positive cases, and even apart from that, in another province, I think was Free State, where a religious leader also contracted the disease, and even some of his members. So we know even in a church, the singing, the exchange of microphone, and all of those things. So the paper basically was just trying to the fact that some of these, our practices, our religious practices, our cultural practices, could promote the spread of COVID-19, and that people should just take these safety measures seriously. I mean, if people want to conduct funeral services, they could just do that, amongst a few family members rather than having the entire community attend. But it's difficult. Actually to get people to adhere both times. So that's actually the story behind that paper that we wrote.
That's a very interesting story. And when I read it, I was like, yeah, of course, this is Africa. It's like weddings and funerals. We don't know how to do them small.
We don't do things small.
We don't know how to do things small. And just to link on that, earlier on, you mentioned that the COVID pandemic has obviously brought so much interest and has forced a lot of people to kind of deviate their work and focus on this. So do you think, as a public health specialist, if somebody's listening and is now like, and is thinking of a career probably in public health, that this is the time to probably get into it? Because I'm assuming there's a lot of funds now that's going to be put into this type of research, in particular, because we've also seen how important public health is, because, in the beginning, there was a lot of fake information that was going around. So we do need people in the forefront who are giving us adequate, rather accurate information. So what is your take on that in terms of where the research is going in the future?
Yeah, definitely. But I think public health has always been that area that would never phase out, because we are always faced with different public health issues. Apart from COVID, we would have other issues. We have issues with infectious diseases. We have issues with our non-communicable diseases. We have a lot of topics, that one could specialize in public health. So, yes, this is the best time if you want to be in public health. But regardless of what is happening now, public health has always been that field that would never phase out. So, and whoever is interested in joining this field is more than welcome, because we still need more people to join this field.
Yeah, for sure. And like you said, it's one of those things that are forever going to be there, because we're always going to be facing with something. A couple of years ago, there was Ebola. Like you said, there's your HIV and AIDS. So many things.
Yes.
And just speaking about your passion for public health, it has actually extended further. You have a Facebook page and a blog called Health Facts with Chinwe, where you share health information, and you started this in April during lockdown as well, right?
Yeah.
Oh,
yes.
Proud birth, so many projects. I love it. What was the inspiration behind you actually doing this project? Just take us a bit into that, please.
Okay, it's something that I've always wanted to do. I must say, I've always wanted to share health information because the issue of misinformation, fake information has always been there right from ages. Even right from when I was still a student, I used to see this information and I'm like, no, this is wrong. Even when I was practicing, I remember how I used to even challenge some prescriptions, written by doctors. I got myself into trouble several times.
Really?
Because I'm like, no, this is wrong. And this is, no, doctor, you should change this and do that, all of that. So I've always had interest in like giving people the right information. But with COVID, I think the issue of misinformation really, really blew up. Like there was a lot of misinformation all over social media regarding the cure for COVID, treatment, even its existence. People were saying all sorts of things that got me, like I was irritated. People were saying a lot of things like steam inhalation could kill the virus. Some would say the virus is not even real. Some would say, no, we are Africans, let's take herbs. We've always been treating ourselves with herbs and all of those. So I thought this should be a perfect opportunity for me to start this that I've always wanted to do. Like, since everyone now is on social media, searching for information and all of that. So I thought, no, this should actually be the perfect time. I've always been procrastinating on this, but I had to just push myself to start this because I noticed that, no, this was going to really even harm people. A lot of those misinformation they were really harmful. So I thought, no, I should also try to even in a bit to minimize the potential harm this false information could cause. I should also try to, make my own contribution in a little way. So that was how I started that Facebook page where I share information, health information from time to time, and even on my blog. So that's how, all of this started.
Yeah, I think you are spot on. That I remember for me personally, I was, in all of these WhatsApp groups. There was a point where I had to remove myself from these WhatsApp groups because I could not, especially in the very beginning, like the type of fake news that was going on was so overwhelming. And, it just created that fear to be way more. And, like we joke with my friends that, like our African mothers and aunties are always forwarding us all of this information of where they got from their other
group. Forwarding. Yeah, they don't.
It was a lot. It was a lot. So I think you creating that group was important. So what sort of, so you said that what sort of information were you then sharing? Did it only focus on the pandemic or was it extending to other information?
Yeah, it's actually mostly on COVID since, that's actually the topical issue now. It's mostly on COVID, but time to time I also share other information. Like recently, after we lost the Chadwick Boseman, I had to write something on colon cancer, just to sensitize people on some of the risk factors that they should look out for and how to, prevent colon cancer. So basically my target actually is just to write on topical issues anyways. Whenever there is this issue going on online and people are whatever it is people are really talking about. So what I do is I just go and then I write something on it. Like few weeks back, people were talking a lot about hydroxychloroquine.
Oh yes.
Anyway, it started initially like few months back, but then all of a sudden it resurfaced, and we started like hearing that, hydroxychloroquine actually is the cure, but no, there's this political move to make people not, and all of that. So I wrote something on hydroxychloroquine, and specifically I was trying to tell people how health decisions, or how treatment, the decisions for treatment are actually taken. So I used like a pyramid of evidence. So usually when there's a new treatment, or this potential treatment, or this candidate treatment has to go through rigorous tests, different trials. Okay, so the fact that you notice that people got better with this medication does not mean that they got better because of the medication alone. So you have to subject whatever it is you have. You need to subject that drug, for example, you need to subject it to the most reliable evidence, the most reliable trial, which is the randomized controlled trial. And that's what we call the gold standard when it comes to evidence-based healthcare. All decisions, healthcare decisions, treatment options are based on trials. And so far, none of these trials have shown that hydroxychloroquine, for example, is effective in treating people with COVID. So my concern was how people made categorical statements. So you don't make such statements if that drug, for example, has not gone through those series of tests, those series of trials, So you can imagine how, and I can remember how I had, in fact, someone even almost insulted me. So that's even the other side of it.
Yeah,
the other side of trying to post these things on social media. You really have to be strong, and I'm not really that strong enough to take some of these insults, because are really, really, really crazy out there. They wouldn't even like engage you in proper discussion, in proper argument. No, the moment they notice that they are not winning, the next thing you see is they begin to haul insults at you. So that's the downside of these things. But then we just have to keep posting the right information, because people really need the
That's very important. I was actually about to ask you that, when you put yourself and you put all of this information out there, I'm just thinking in the case of, in America, where all of this, especially, was really, really big, where, for example, you had Trump, who says one thing and then everybody believes him, but they're not believing the actual experts. And I just wanted to ask you how frustrating, rather, number one, and how do you deal with this, especially when you have these people who are pushing this fake news, number one, and pushing this agenda. And then you have people who are not even, for example, I don't want to insult anyone, but let's say somebody who's never touched a book in anything that's got to do medically. Then they tell you, no, they read an article on Google that says that this is proven. So how do you deal with that? Because that's the problem with social media, that it creates a space for that backlash. And then that backlash also sometimes become a little bit personal. And it must be hard. So how do you keep on coming back and educating some of the people who are very stubborn and they don't want to learn?
Honestly, I have not figured that out, because I must say it's not easy. There was this day I spent even almost an hour arguing with this particular guy. He kept on, like you said, it's quite good, like with his research. He goes to bring links that I must read, that he even doubts. So someone even had to tell him, no, do you know you're even speaking to, this is someone who is a public health researcher, so you should even listen to her. The person said, no, I don't care. What he started saying, no, he brought that, I'm not even reading, I should go read. So he brought so many links for me to go and do my work that he feels I'm not even doing my assignment properly.
Oh, my words.
So you can imagine, and then I thought of ignoring him, but then again, I was like, if I ignore this guy, what would other people say? They would even believe that he's right. So I had to stay there for over an hour arguing with him. So you see, those I really can't say this is the best way to handle this. I'm still trying to figure that out. But honestly, it's not easy. It's really not easy. It can be emotionally drained. It can even be discouraging, honestly, because sometimes you're like, I really don't want. I hope this post would not attract another backlash. Like I say those prayers before I even post. I'm like, I hope no one sees this thing and comes back to me, But like you said, I think we just have to just keep writing, Since it's not even physical, what I do sometimes is I just post these things and then I don't go back to see people's responses. I just leave it and then go back maybe after so many hours, so that it doesn't spoil my day. I just post it in the morning and just go and relax and come back later to see what people are saying. So, it's not easy, I must say. It's not.
It's not, but for the ones who are going to listen, we appreciate the work that all of you public health experts are doing. And we've seen how important it is to have people telling us the correct information because, sometimes the people who talk, they really don't know what they're talking about. So just to wrap it up, I just wanted to ask you, what advice would you then give to somebody who's listening or who is inspired by your story and everything that you do about getting into the field of science, but specifically more into your field, considering the journey that you've been on?
Okay, I would say please go for it. I know that it's not an easy journey. Like I would not promise you that it is an easy journey, but it is worth it. So if you are interested, don't hesitate, don't procrastinate, don't overanalyze, because sometimes you're wondering, okay, what does the future hold and all of that. If this is what you truly want to do, please go for it and go for it now. And I would also like to talk to women, if you are interested in this, also you have to don't also think twice, just go for it. I know we have, like in Africa, women would always not want to pursue our degrees beyond the first degree, because of societal expectations, family expectations and all of that. But I think for women, this is even the best time to be a scientist because there is a lot of support out there for women, both financially and all of that, for women who are in science. So the world has changed. Science is no longer a male-dominated area as we used to think. So there are a lot of women who are doing an amazing job in the field of science. So if you want to join this, please do not hesitate. Go for it.
Yeah, and one of them is you. And, so let's join. We also want to join the Red Gown Club. That's why some of us are hot on the heels, even though it's not easy. Like you said, it really isn't easy. But I think it's important that we, especially African women, we get into these places which we never thought we could be at. So, and seeing people like yourself who are occupying these spaces, it's very inspiring. So thank you so much for coming on and sharing your story and just teaching us more about what you do as well.
Thank you so much. Thank you for having me.
It's been an absolute pleasure. And to everybody else who's listening, thank you once again for tuning in to another episode of the Root of the Science podcast with your girl, Anne with an E. Until next time, goodbye.